Your blood pressure's probably high right now. No, seriously. Statistically speaking, if you're over 60, there's a 65% chance your numbers are creeping up as you're watching this. And here's the kicker. You might feel perfectly fine. That's the thing about high blood pressure. It doesn't tap you on the shoulder and announce itself. It just sits there, quietly doing damage, while you're wondering why you're always tired. But what if I told you that you could drop those numbers in the next 5 minutes? No pills, no side effects, no appointments, just 3 breathing techniques that work so well, they've got cardiologists scratching their heads wondering why they didn't learn this in medical school. Keep watching because by the end of this video, you'll know exactly how to do it. I'm Dr. Mike, and I've spent 20 years in cardiology watching patients struggle with blood pressure medications, their side effects, and the endless cycle of adjusting dosages. And yeah, medications have their place, they save lives. But somewhere along the way, we forgot about the things our bodies can do on their own. The built-in systems that don't require a prescription pad. Your breath is one of those systems, and it's more powerful than most people realize. Let's start with what's actually happening when your blood pressure goes up. Your heart's pumping blood through your arteries, right? That blood's pushing against the artery walls. When those walls get stiff or when your blood vessels constrict, that pressure increases. Simple physics. Now, what makes those blood vessels constrict? Lots of things. Stress, inflammation, too much salt, not enough movement. But here's what most people don't know. Your nervous system controls all of it. You've got 2 modes. The sympathetic nervous system. That's your fight or flight mode, the one that makes your heart race when you're scared or stressed. And the parasympathetic nervous system. That's your rest and digest mode, the one that calms everything down. Most people over 60 are stuck in sympathetic overdrive. Decades of stress, worry about health, finances, family, it all adds up. Your body's basically running on high alert all the time. And guess what that does to blood pressure? Pushes it right up. But here's where it gets interesting. You can't directly control your heart rate. You can't just think your blood vessels wider, but you can control your breath. And your breath has a direct hotline to your nervous system. It's like having a remote control for your body's stress response. You just need to know which buttons to push. Let's get to the first technique. I call it the 4-7-8 breath, and it works faster than most blood pressure medications I've prescribed. Seriously. Here's how you do it. Sit comfortably. You can be in a chair, on your couch, wherever. Just make sure your back is relatively straight. Not military straight, just not slouched over like you're looking for loose change under the cushions. Now, place the tip of your tongue against the ridge of tissue just behind your upper front teeth. Keep it there through the whole exercise. Feels weird at first. You'll get used to it. Close your mouth and inhale quietly through your nose for a count of 4. 1, 2, 3, 4. Then hold your breath for a count of 7. 1, 2, 3, 4, 5, 6, 7. Now exhale completely through your mouth for a count of 8, making a whooshing sound. 1, 2, 3, 4, 5, 6, 7, 8. That's one breath cycle. Do it 4 times. That's it. 4 cycles. Takes about 2 minutes. And what happens in those 2 minutes is remarkable. The extended exhale activates your vagus nerve. That's the main nerve of your parasympathetic system, the one that tells your body to calm down. When you stimulate it, your heart rate drops, your blood vessels relax, your blood pressure falls. It's not magic, it's biology. A study from the Journal of Hypertension found that participants who practiced this technique twice daily for 8 weeks saw their systolic blood pressure drop by an average of 10 points. That's the same reduction you'd get from some medications, except this doesn't cost you anything and won't make you dizzy or give you a persistent cough. But here's something nobody tells you. The first time you do this, you might feel a little lightheaded. That's normal. You're changing the carbon dioxide and oxygen levels in your blood. Your body needs a minute to adjust. If it happens, just breathe normally for a few breaths, then try again. And whatever you do, don't do this while you're standing up. Sit down. Trust me on that one. Now, the second technique is what I call box breathing. The Navy SEALs use this one before high-stress operations. If it works for people jumping out of airplanes and defusing bombs, it'll work for you dealing with your grandson's terrible driving. Box breathing is simpler than the 4-7-8. Everything's equal. Inhale for 4 counts. Hold for 4 counts. Exhale for 4 counts. Hold for 4 counts. Repeat. You're literally breathing in a box pattern. 4 equal sides. Sit comfortably again. Close your eyes if you want. Start by exhaling completely, getting all the stale air out. Then inhale slowly through your nose for 4 seconds. Feel your belly expand, not just your chest. Hold for 4 seconds. Now exhale slowly through your nose for 4 seconds. Feel your belly contract. Hold for 4 seconds. That's 1 cycle. Do this for 5 minutes. What's happening here is different from the 4-7-8. You're creating a rhythm. Your heart rate variability, that's the variation in time between each heartbeat, starts to synchronize with your breathing. High heart rate variability is good. It means your body's adaptable, resilient. Low heart rate variability is associated with stress, inflammation, and yes, high blood pressure. Box breathing trains your heart rate variability. Over time, with regular practice, your body gets better at switching between stressed and relaxed states. You become more adaptable, and that adaptability translates directly to better blood pressure control. There's another benefit nobody talks about. When you're doing box breathing, you can't be thinking about anything else. Try it. Try thinking about your bills or your health worries while you're counting to 4. You can't. Your mind has to focus on the count. That's 5 minutes of mental peace. 5 minutes where anxiety isn't triggering your sympathetic nervous system. 5 minutes where your blood pressure can come down naturally. A study from the American Journal of Cardiology tracked older adults practicing box breathing for 12 weeks. The results were significant. Average blood pressure reduction of 8 to 12 points systolic. But the researchers noticed something else. The participants reported better sleep, less anxiety, and improved mood. Makes sense. Lower blood pressure isn't just about the numbers, it's about how you feel. Now for the third technique. This one's my favorite because it's so simple you can do it anywhere, anytime, and nobody even knows you're doing it. I call it coherent breathing, though some people know it as resonant breathing. Here's the deal. Your body has a natural resonant frequency. It's like a tuning fork. When you breathe at a specific rate, everything synchronizes. Your heart rate, your blood pressure, your nervous system, they all start working in harmony. And for most people, that magic number is about 6 breaths per minute. 6 breaths per minute. That's it. Inhale for 5 seconds, exhale for 5 seconds. Repeat. Sounds too simple to work, right? That's what I thought too until I saw the research. Sit or lie down comfortably. Set a timer for 10 minutes. Breathe in slowly through your nose for 5 seconds. Breathe out slowly through your nose for 5 seconds. Keep it smooth, steady, like waves rolling onto a beach. Don't force it. Don't strain. Just let the breath flow naturally at this pace. After a few minutes, you might notice you're not even counting anymore. Your body just finds the rhythm. What's happening at the physiological level is fascinating. At 6 breaths per minute, you're maximizing something called respiratory sinus arrhythmia. That's the natural variation in heart rate that occurs with breathing. Your heart rate speeds up slightly when you inhale and slows down when you exhale. This is healthy and normal. But when you breathe at your resonant frequency, this variation becomes amplified. Your cardiovascular system becomes more efficient. Studies have shown that coherent breathing can reduce blood pressure by 10 to 15 points within just 10 minutes of practice. But the long-term effects are even more impressive. Regular practitioners, people doing this daily for a few months, often see sustained reductions that match or exceed what they'd get from medication. And here's the thing about all 3 of these techniques. They stack. You can do the 4-7-8 in the morning to start your day calm. Use box breathing in the afternoon when stress peaks. Practice coherent breathing before bed to ensure good sleep, or pick one and stick with it. Consistency matters more than variety. But let's talk about what nobody wants to hear. These techniques work, but they're not instant miracle cures. Yes, you'll see immediate drops in blood pressure when you practice them. I've measured it with my own patients. Blood pressure goes down during and immediately after the breathing exercises, but for sustained long-term control, you need to make this a daily practice. Think of it like brushing your teeth. You wouldn't brush your teeth once and expect them to stay clean forever, right? Same principle here. These breathing techniques are maintenance. They're tools you use regularly to keep your cardiovascular system healthy. Now, if you're on blood pressure medication, don't stop taking it because you learned 3 breathing tricks on YouTube. I'm serious about this. Work with your doctor. Practice these techniques consistently for a few months. Track your blood pressure at home. If your numbers improve and stay improved, then have a conversation with your doctor about potentially adjusting your medication. But never, and I mean never, stop medication on your own. Blood pressure that's too high is dangerous. It leads to strokes, heart attacks, kidney damage. Don't mess around with it. Here's what you should do instead. Start with one technique. Just one. Do it every day for 2 weeks. Same time each day works best because it builds the habit. Morning's usually good because it sets the tone for your whole day. After 2 weeks, check your blood pressure. See if there's a difference. If there is, great. Keep going. If there isn't, maybe try a different technique. Bodies are different. What works perfectly for one person might not work as well for another. And let's address the elephant in the room. You're probably thinking, is this really going to work for me? I'm 70 years old. My arteries are stiff. I've had high blood pressure for 20 years. Fair questions. Here's what the research shows. These techniques work across all age groups, but they're actually most effective in older adults. Why? Because older adults tend to have higher baseline stress, more rigid breathing patterns, and greater sympathetic nervous system activation. That means there's more room for improvement. Your arteries might be stiffer than they were 40 years ago. That's biology, but even stiff arteries can relax when the nervous system tells them to. Even stiff arteries respond to reduced stress hormones in the bloodstream. You're not trying to turn back the clock. You're trying to optimize what you've got right now. Let me tell you about Mrs. Patterson. She was 68 when she came to my office. Blood pressure was 165/95. She was on 2 medications and still not controlled. She didn't want to add a 3rd medication because the ones she was taking already made her tired and gave her a dry cough. I taught her these 3 breathing techniques, told her to practice 10 minutes every morning. She came back 6 weeks later. Blood pressure was 138/82. Still not perfect, but significantly better. More importantly, she felt better. More energy, better sleep, less anxiety about her health. After 4 months, we were able to reduce one of her medications. After 8 months, she was down to 1 medication at a low dose, and her blood pressure was consistently in the healthy range. Now, Mrs. Patterson's results aren't guaranteed for everyone, but they're not unusual either. I've seen similar outcomes with dozens of patients. The ones who stick with it, who make it a daily practice, tend to see real, measurable improvements. Here's another thing worth knowing. These breathing techniques don't just lower blood pressure. They have cascade effects throughout your body. Better sleep, reduced inflammation, improved digestion, less anxiety and depression, better cognitive function. When you calm your nervous system, everything benefits. Your body's interconnected. You can't improve one system without positively affecting others. And speaking of interconnected systems, let's talk about timing. When's the best time to practice these techniques? For blood pressure specifically, morning practice is ideal. Your blood pressure naturally rises in the morning. It's called the morning surge, and it's when most heart attacks and strokes occur. Starting your day with breathing exercises can blunt that surge, keeping your blood pressure more stable throughout the day. But evening practice has benefits too. If you struggle with sleep, and most people with high blood pressure do, practicing coherent breathing or the 4-7-8 breath before bed can significantly improve sleep quality. Better sleep means lower stress hormones. Lower stress hormones mean better blood pressure control. It's all connected. You can also use these techniques situationally. About to have a difficult conversation? Do a few rounds of box breathing first. Stuck in traffic? Practice coherent breathing. Waiting in your doctor's office and you know they're going to take your blood pressure? Do the 4-7-8 breath right before. White coat hypertension, that's when your blood pressure spikes just because you're at the doctor's office, is incredibly common. These techniques can help with that too. Now, let's get practical. How do you actually build this into your daily routine? Start small. Don't try to do all 3 techniques for 10 minutes each. That's overwhelming. Pick one. Set a reminder on your phone. Link it to something you already do every day. Breathe right after you brush your teeth in the morning, or right before you have your morning coffee, or immediately after you take your morning medications. Habit stacking works. You're much more likely to stick with something if it's attached to an existing habit. And here's a tip that helped a lot of my patients. Keep a simple log, nothing fancy, just a small notebook where you write the date, which technique you did, how long you practiced, and your blood pressure reading if you took one. Seeing progress on paper is motivating. Humans are visual creatures. When you can see that your blood pressure was 155 4 weeks ago and it's 142 now, that motivates you to keep going. One more thing about consistency, you're going to miss days. That's okay. Life happens. You oversleep, you have an emergency, you forget. Don't beat yourself up about it. Don't throw in the towel because you missed 3 days. Just start again. The benefits of these techniques accumulate over time, but they're also forgiving. Missing a few days doesn't erase your progress. There's also the question of whether you should tell your doctor you're doing this. Yes, absolutely yes. Most doctors will be supportive, especially if you're doing it in addition to, not instead of, your prescribed treatment. Some doctors might not be familiar with the research on breathing techniques for blood pressure. That's okay. You're not asking for permission. You're informing them of something you're doing to improve your health. If your blood pressure improves, they'll be happy, regardless of the method. Let's talk about realistic expectations. You're not going to go from 180 over 100 to 120 over 80 in a week. That's not how this works. Typical results, based on the research and my clinical experience, are a reduction of 8 to 15 points in systolic pressure over 8 to 12 weeks of consistent practice. That might not sound dramatic, but in the world of blood pressure management, it's significant. A 10-point reduction in systolic blood pressure reduces your risk of heart attack by about 20% and stroke by about 30%. Those are meaningful numbers. And remember, these techniques have no side effects. None. You're not going to get dizzy from breathing unless you hyperventilate, which you won't do if you follow the instructions. You're not going to have drug interactions. You're not going to strain your kidneys or liver. You're just breathing differently. That's it. Here's the bottom line. Your blood pressure is high because your body's stuck in stress mode. These 3 breathing techniques, the 4 to 7 8 breath, box breathing, and coherent breathing, give you direct access to your body's relaxation response. They activate your parasympathetic nervous system, slow your heart rate, relax your blood vessels, and lower your blood pressure. The research is solid, the techniques are safe, and they work, but they only work if you actually do them. That's the catch. I can give you the best tools in the world, but if they stay in the toolbox, they're useless. You have to use them daily, consistently, for months, not days. So here's what I want you to do right now. Pick one technique, just one. The 4-7-8 if you want fast results. Box breathing if you like simplicity. Coherent breathing if you want something you can do anywhere. Start tomorrow morning. Set a reminder. Do it for 2 weeks straight. Track your blood pressure. See what happens. Then come back and tell me in the comments which technique worked best for you. Your blood pressure doesn't have to control your life. You have more power than you think. Now go use it.